Hello and welcome back to InterpreterPrep.com. We're going to be covering the basics of obstetrics and fertility in these next two presentations. Let me tell you, the stork tale is a lie. If having a baby was only that simple, it's a lot more complicated, but after we go through these presentations, you'll know all the details about how babies really get here. Now, it's important to begin by saying that every month there are changes in a woman's hormone level. These hormonal changes produce effects on the ovaries and the uterus known as the menstrual cycle, which causes a monthly vaginal bleeding known as the period. Day 1 of the menstrual cycle is signaled by the first day of bleeding. Now, where's the bleeding coming from? It's caused by the shedding of the inner lining of the uterus called the endometrium. Once the bleeding stops, the endometrium will begin to rebuild itself and thicken under the influence of the estrogen being secreted by the growing ovarian follicles. Halfway through the cycle, on day 14, one of these follicles pops and ovulation occurs, as we see here in the bottom right of this image. What's left of the burst follicle is now known as the corpus luteum, which secretes a great deal of progesterone, which stimulates the endometrium to increase its secretions of mucus and glycogen, creating a pregnancy-friendly environment in case a fertilized egg should appear. Progesterone also causes an increase in the body's temperature, which is why you may have seen women with a thermometer in hand trying to get pregnant. Now, if a fertilized egg doesn't appear, the corpus luteum begins to shrink, what's known as regression, and progesterone levels start to fall. Without the support of the progesterone, the poor endometrium will start shedding and the next menstrual period begins. A tampon or a pad is used by women to collect the menstrual blood during their period. Had a fertilized egg arrived, it would have implanted itself in the endometrium and begun to make a hormone called human chorionic gonadotropin, HCG. It's the one they measure in a pregnancy test. This hormone keeps the corpus luteum up and running so that progesterone keeps coming, and that keeps the endometrium from shedding and the pregnancy going. It's a complex process, but basically you have the ovary popping out an egg every month, and every month you have a uterus whose inner lining engorges in preparation to catch a fertilized egg, but cries red tears if no one appears. Can you guess what we're going to talk about now? Okay, let's talk a little bit about how this girl got pregnant. As you can see in this image, ovulation has occurred and we see an ovum on its journey down the fallopian tube where it encountered some sperm, and fertilization occurred in the tube. The sperm and the egg's DNA came together to form the first cell that began dividing while it continued its trip down the tube to embed itself in the back wall of the uterus and continue to there grow. During the first 2 months of life, this little human being is called an embryo. After the second month, the embryo is now called a fetus. The fetus grows bathed in amniotic fluid and is connected to the placenta by the umbilical cord. You can imagine the placenta like a liquid-filled balloon with a baby inside, which is attached in part to the uterus. Through the placenta, the necessary oxygen and nutrients get to the fetus. During the next months of pregnancy, the uterus, the placenta, and the baby will grow. This growth will be verified by the obstetrician who checks the growth of the baby bump at each doctor's visit and through serial OB ultrasounds. If all goes well, pregnancy will continue until somewhere between 37 to 41 weeks, point at which birth will take place. If the baby is born before the 37th week of pregnancy, it's considered premature. During those approximately 9 months of pregnancy, a woman's silhouette will change as her abdomen grows and she gains approximately 30 pounds. When the top part of the baby bump has reached the navel, we're halfway through the pregnancy. And when the top part of the baby bump has reached just below the breastbone, as we see here, we're nearing delivery time. Babies are normally upside down in the womb, as we see here on the right side. This is called cephalic presentation, as opposed to the image on the left side where the fetus is sitting in the womb. That's known as breech presentation. In this last case, a C-section is usually done to deliver the newborn. The C-section is a surgery where an incision is done through the abdomen and then the uterus is also cut to extract the baby. Sometimes there are two babies. This is known as twins, which looks something like this. Now, if a C-section is not needed, then a vaginal delivery is the way to go. During a vaginal delivery, the fetus will have to go down through the pelvis head first. The female pelvis is made up of 4 bones. We have the right and the left iliac bones, which are joined in the front by a joint called the symphysis pubis. They're also joined in the back to another bone called the sacrum by the sacroiliac joints. The 4th bone here is the coccyx. You can think of the pelvis like a cylinder. The entry to that cylinder at the top is called the pelvic inlet, and the exit below is called the pelvic outlet. The process of measuring the size of the pelvis to see if the fetal head will be able to pass through the birth canal during a vaginal delivery is called pelvimetry. It's done to avoid dystocia, which means difficult childbirth, and it will serve to determine if there is a need for a C-section. There are a few things that indicate that labor is soon to begin. One is the dropping or lightning sensation perceived by the mother when the baby descends into the pelvic inlet. Another is the bloody show. This occurs when the mucus plug in the cervical os is dislodged because the cervix is beginning to efface, disappear. A vaginal discharge consisting of mucus tinged with blood will appear. This is known as the bloody show. Also, another thing that indicates that labor is soon to begin are the increasing contractions. Contractions are counted every 10 minutes. When a woman persistently has 2 contractions or more every 10 minutes, it is signaling the start of labor. As labor continues, contractions become more frequent and last longer. Another thing that occurs when labor is soon to begin is rupture of membranes. It's also known as water breaking. A gush of amniotic liquid trickles down the vagina. If labor doesn't begin spontaneously, it will be induced using prostaglandins and oxytocin. Once labor begins, it's divided into the following 3 stages. The 3 stages of labor are 1. Dilation. During this stage, the cervix gets shorter, disappears, and then begins dilating, begins opening. The second stage of labor is fetal expulsion. As the fetus twists its way down the birth canal, the head appears, this is known as crowning, at the vaginal introitus, and the patient is instructed to push with every contraction to deliver the head. The obstetrician will take a hold of the head and give a gentle tug downwards to free the upper shoulder, after which the baby just slides out. When the shoulder gets stuck, we get what's called shoulder dystocia. The third stage of labor is placental expulsion. After the baby has been delivered, the doctor clamps the umbilical cord, then cuts it, gives the baby to the pediatrician who will make sure that the baby's fine. A few minutes later, the placenta will detach itself from the uterus. With gentle movements, tugging from the cord, the obstetrician will help liberate and deliver the placenta, which later will be inspected to make sure it all came out. It should look something like this image. The period that follows the birth of a child is known as postpartum or puerperium. The postpartum vaginal discharge is called lochia. And the closing act of this amazing show we've just seen is known as menopause, which occurs between 44 to 55 years of age. When this happens, women stop having their periods, stop ovulating, and can no longer bear children. I'm going to mention some of the standard prenatal care, which includes the following. Prescription of folic acid. This is done to prevent a birth defect called spina bifida. Prescription of iron in the second half to prevent mom from getting anemic. Blood pressure monitoring. Serial OB ultrasounds to check the fetus, the amount of amniotic fluid, and to check the placenta. A RhoGAM shot for the Rh negative mothers. This prevents development of antibodies against the baby's red blood cells. Now let's mention some signs of medical complications of pregnancy. Some of these signs are increasing blood pressure, increasing blood sugar, bleeding, excessive vomiting, fever, headaches, seizures, blurred vision and abdominal pain, low back pain, and the absence of fetal movements. Now let's mention some of the medical complications of pregnancy. First, we have ectopic pregnancy. This occurs when the ovum implants itself in a place different from the back wall of the uterus, like the fallopian tube, for example, in which case it's called a tubal pregnancy. Another complication is molar pregnancy. This is an abnormal pregnancy where a mix of tissue forms but no fetus to be found. I'm sorry to define it that way, but it would take too long to explain in detail. Some moles can suffer malignant transformation to cancer, in which case they're known as choriocarcinoma. Another complication is gestational diabetes, and this means the appearance of elevated blood sugar during the last half of pregnancy. We also have gestational hypertension, which is the appearance of high blood pressure in the second half of pregnancy. Preeclampsia. When we talk about preeclampsia, is because they also find protein in urine, which means the kidneys being affected. So there's high blood pressure, but there's also protein in urine, kidney being affected by the high blood pressure. So we had said that gestational hypertension was the appearance of high blood pressure in the second half of pregnancy. When we also found that there was protein appearing in the urine, this would be known as preeclampsia. Now, on top of all that, if we add the headache, blurred vision, and seizures due to brain swelling, this condition is known as eclampsia. Another complication is intrauterine growth retardation. Intrauterine growth retardation is diagnosed by a small baby bump and confirmed by ultrasound. It means that there's a failure to thrive. Then we have oligohydramnios. Oligohydramnios indicates that there's not enough amniotic fluid, as opposed to polyhydramnios, which is the excess of amniotic fluid. We have to mention miscarriage, also known as spontaneous abortion. This occurs before the 20th week of pregnancy, and there's a few terms that we need to clarify here. In other words, if a pregnant woman loses a baby before the 20th week of pregnancy, we have a spontaneous abortion or miscarriage. A threatened abortion is when a pregnant woman comes in bleeding with a closed cervix, and the abortion may or may not occur. That's why it's a threatened abortion. Then we have complete abortion. Complete abortion occurs when the products of conception, and we're referring to fetal tissues and the placenta, have been expelled from the uterus. Then we have incomplete abortion. Incomplete abortion means that there are still retained fetal tissues. A D&C will need to be done in this case. The missed abortion is when the fetus is still inside the womb but dead. And septic abortion is when an infection in the womb occurs after the abortion. Then we have placental abruption. Placental abruption means that there's a detachment of a normally located placenta. The placenta is detaching itself from the uterus. This is not good. A woman has contractions with splitting back pain when this occurs. Then we have what's known as placenta previa. Placenta previa means that there's a low-lying placenta. It's located lower than it should be. Compare in the image with the normal placenta, which is higher, as you can see in this cross-section image of the uterus. If the placenta previa is located too low or is covering the cervical os, then a C-section is done to deliver the baby. Then we have failure to progress. This is a complication during the delivery. It means that the baby's stuck, not coming down. It may require amniotomy. Amniotomy is when they punch a hole in the bag of waters, or it also may require the use of forceps to deliver the baby. Then we have premature rupture of membranes. This is what we typically see in soap operas, where you hear, "Oh, my water broke." If the baby's gestational age and lung maturity permit it, then the baby's delivered when this happens. A possible complication is a prolapsed umbilical cord. It's a complication of the premature rupture of membranes. And a prolapsed umbilical cord means that the cord, because the liquid gushed out, is starting to get squished. This is not a very academic explanation on my part, but it's pretty easily understood. When this happens, in other words, when you get a prolapsed umbilical cord, this becomes an obstetrical emergency, and the fetus must be delivered as soon as possible because it's not getting enough oxygen and brain damage may occur. This is known as cerebral palsy. Another of the many complications of pregnancy is preterm labor. This is when labor occurs before week 37. Babies born preterm generally go to NICU. and NICU stands for Neonatal Intensive Care Unit. These babies are at high risk of getting sick and dying because their organs, especially their lungs, are underdeveloped, and that may give way to what's known as respiratory distress syndrome, where the baby can't breathe well. Then we have fetal malpresentation. We've mentioned this before. The most frequent malpresentation is breech. If the obstetrician tries to turn the baby around and correctly position him while baby is still inside the uterus and does this by pressing on mom's tummy, this is known as external version. Then we have postpartum hemorrhage. Postpartum hemorrhage occurs when too much blood is lost during delivery. I'm talking about more than 500 cc's. It may be due to the uterus not contracting after delivery, what's known as a boggy uterus. This may require the administration of oxytocin and or uterine massage to try to stimulate that uterus to ball up and stop bleeding. Other times, surgery to repair lacerations that the uterus may have suffered, or a D&C may have to be done to clean out the uterus. Then we have postpartum infections. After birth, there is essentially an open wound in the uterus, and that wound can infect. When an infection occurs in the uterus, this is known as endometritis. If the infection not only gets into the uterus, causing the endometritis, but keeps going, gets into the bloodstream and spreads to other organs, causing abdominal infection, a peritonitis can occur. And when this happens, it can get even worse, becoming a generalized infection, and that means that this infection just spreads out everywhere. And with that infection has gone from the uterus to the abdomen and elsewhere, we're talking about what's known as sepsis, generalized infection. This is very severe. Last but not least, we have nuchal cord. When we talk about nuchal cord, we're referring to a umbilical cord that's wrapped around the neck of the fetus. Now let me talk about a few of the diagnostic procedures used in obstetrics. We have the regular ultrasound, which is silent, which is our regular OB ultrasound, and then we have the Doppler ultrasound, which makes a swishing, raspy noise. This one's used to evaluate blood flow, like the blood flow through the umbilical cord, for example. Another diagnostic procedure is the stress test. Stress test is a test which monitors the fetal heart rate during a contraction. It looks for dips or decelerations in the heart rate, which may be indicating that the fetus is not getting enough oxygen. This is also known as fetal distress. Then we have amniocentesis. Amniocentesis is done to obtain samples of amniotic fluid to do a karyotype. This study is used to rule out Down syndrome. Amniocentesis is also used to evaluate fetal lung maturity in case they need to induce premature labor. Then we have labs like the CBC, which stands for a complete blood count, blood typing, urinalysis, urine culture, rubella antibody titer, syphilis screen, the BDRL, test for gonococcus, test for chlamydia and toxoplasmosis, and alpha-fetoprotein to screen for Down syndrome, just to name a few. Now, let's mention some treatments used in obstetrics. Tocolytics are used in preterm labor. They're used to slow down contractions. For example, like terbutaline and nifedipine. There are also drugs used to induce labor, like oxytocin and prostaglandins. For pregnant women who develop hypertension, a drug used is methyl-dopa. Steroids are administered. One of these commonly used is betamethasone to accelerate lung maturation in the fetus. Magnesium sulfate is used for seizure control, eclampsia. C-section, we've mentioned before, is indicated in a case where there's active genital herpes infection in the mother, if the baby's too big, or when there's a placenta previa, etc. DNC stands for dilation and curettage. It's a surgical procedure done to clean out the uterus of any bits of placenta or other remaining tissues. Episiotomy is a surgical incision used to enlarge the vaginal orifice. It's done to avoid any tearing in the vagina during delivery. Then we have epidural anesthesia. When they do epidural anesthesia, anesthesia is injected into the spine, into the epidural space. It's done to reduce pain during labor. Now it's time for review, so let's go over the terminology mentioned in this presentation in English and in the target language. Obstetrics, obstetricia. Fertility, fertilidad. Infertility, infertilidad. Menstrual cycle, ciclo menstrual. Ovulation, ovulación. Tampon, tampón. Pad, toalla femenina. Embryo, embrión. Fetus, feto. Umbilical cord, cordón umbilical. Obstetrician, obstetra. OB ultrasound, ultrasonido obstétrico. Birth, nacimiento. Cephalic presentation, presentación cefálica. Breech presentation, presentación de nalgas. C-section, cesárea. Twins, mellizos. Identical twins, gemelos. Pelvis, pelvis. Birth canal, canal de parto. Vaginal delivery, parto vaginal. Dystocia, distosia. Labor, trabajo de parto. Contractions, contracciones. Rupture of membranes, rotura de membranas. Induced labor, parto inducido. Prostaglandins, prostaglandinas. Oxytocin, oxitocina. Dilation, periodo de dilatación. Fetal expulsion, periodo de expulsión. Crown, coronar. Push, pujar. Placental expulsion, alumbramiento. Premature, prematuro. Postpartum, posparto. Folic acid, ácido fólico. Iron, hierro. Spina bifida, espina bífida. Ectopic pregnancy, embarazo ectópico. Tubal pregnancy, embarazo tubárico. Molar pregnancy, embarazo molar. Choriocarcinoma, coriocarcinoma. Dehydration, deshidratación. Gestational diabetes, diabetes gestacional. Gestational hypertension, hipertensión gestacional. Preeclampsia, preeclampsia. Eclampsia, eclampsia. Intrauterine growth retardation, retraso de crecimiento intrauterino. Oligohydramnios, oligohidramnios. Polyhydramnios, polidramnios. Miscarriage, aborto espontáneo. threatened abortion, amenaza de aborto, incomplete abortion, aborto incompleto, missed abortion, feto muerto y retenido, septic abortion, aborto séptico, placental abruption, desprendimiento de placenta, placenta previa, placenta previa, painless, indoloro, failure to progress, parto detenido, forceps, cerebral palsy, parálisis cerebral, preterm labor, parto prematuro, fetal malpresentation, distosia de presentación, endometritis, endometritis, peritonitis, peritonitis, sepsis, sepsis, nuchal cord, circular de cordón, Doppler ultrasound, ultrasonido Doppler, blood flow, flujo de sangre, fetal distress, sufrimiento fetal, amniocentesis, amniocentesis, karyotype, cariotipo, urinalysis, examen de orina, rubella, rubiola, alpha-fetoprotein, alfa-fetoproteína, Down syndrome, síndrome de Down, toxoplasmosis, toxoplasmosis, tocolytic, tocolítico, terbutaline, terbutalina, nifedipine, nifedipina, methyldopa, metildopa, betamethasone, betametasona, magnesium sulfate, sulfato de magnesio, dilation and curettage, legrado, episiotomy, episiotomía, epidural anesthesia, anestesia epidural. In this presentation, we've gone over many terms related to obstetrics while we discuss topics like the menstrual cycle, fertilization, pregnancy, and labor and delivery. We've also discussed some obstetric complications, diagnostic procedures, and treatments. At the end of the presentation, a list of 86 related terms were provided in English and in the target language for you to review. I hope you've enjoyed this lesson and come away with a better understanding of the field of obstetrics and the terms related to this field of medicine. Thank you for choosing InterpreterPrep.com, and I'll see you back in the next presentation.